welcome all of you for this health and wellness session organized jointly by Rotary Nagar and Chronic Foundation. This is a fourth session in this lockdown period we initiated, and I'm happy to mention we are getting a very good response, and a lot of families have started watching together, and they are sending appreciation for this. Today we have chosen the body part involves which people generally hesitate to discuss, but it is important to take care. Whether you are a sports person, runner, or you do exercise or not. The topic is urology health. We have with us a consultant urologist from NU Hospital, Bangalore. He is an alumni from Bangalore Medical College and completed MBBS, MS in general surgery and DNB urology from Bangalore. He is the first Asian urologist to do the European Society Penile implant fellowship from Spain. He further specialized in penile reconstruction in Belgrade and male infertility from the University of Illinois at Chicago, USA. His primary subspecialty interest in urology is andrology, which deals with surgical aspects of erectile dysfunction, male infertility, and testosterone replacement therapy. He is the panel member, Urology Society of India, Guidelines Committee on Male Infertility. He has many national and international journal publications to his credit. He has also presented his research papers at international urology forums in Chicago, Budapest, Bangkok, and Singapore. Here I present Dr. Pramod Krishnappa. Welcome you, sir.
Thank you, Mr. Ramesh. Thank you very much for the introduction.
Now over to Dr. Pramod Krishnappa.
Thanks, Mr. Ramesh and your team for giving me this wonderful opportunity. So welcome you all. A very good morning. So I'm myself, Dr. Pramod. So let me give you a brief talk into the urological aspects. To be a urologist, it takes around 11 years. So it's difficult to summarize everything in just 30-40 minutes. So I'll just touch upon the topics which we very commonly see in urology day-to-day practice. Just to brief you, so the kidney starts, the urology mainly involves the organ starting from the kidney, and then it goes down to the tube called ureter, and then this is the bladder where all the urine gets collected and then it comes out. So from the kidney till here, it is the same in both males and female, but beyond the bladder, again in males it is different because all the reproductive organs get added. Similarly, here in the females, the uterus gets added. So beyond the bladder, the anatomy of the males and the females slightly change. Okay, so in urology, there are different subspecialties. Let's not go into details of this. So the topics that I would like to cover are these topics. So I think most of you have, if somebody is there beyond 50 or 60 years in this group, most of your ultrasound reports would be showing prostatomegaly. So let's discuss about all these things, and kidney stones are very rampant especially in South Asia. And also what are the discussions which all of us should be knowing about the kidney transplant and about a newer specialty which is called as the andrology. Okay, let's discuss about the prostate now. See, normally you see this is the bladder where the urine gets collected, and normally this is how the passage should be. So this is the prostate, what you see on either side of this urinary channel. This is the prostate. This is how normally it should be. Every male has a prostate. A female does not have a prostate. So when the prostate enlarges, this is how it happens. So basically the urine passage gets occluded and a person may start getting urinary symptoms. The most common symptoms being poor flow, poor urine. They say that the speed of the urine is less. And if you see, this is one of the most common diagnosis, most common condition that we all urologists see in men who present to our OPD between 50 to 75 years. And if you see people over 80 years of age, almost 90% of them will have some symptoms because of the prostate. And like I said, these are all the common symptoms which most of the patients report to us. Mostly they say I leak urine many a times and I have to put more pressure to pass urine and I frequently keep going to pass urine. So these are the common conditions what we hear from the prostate patients. And when these patients come to us, we usually do a rectal examination using a finger. We basically, if you see here, this is the prostate gland here. So by putting a finger here, we will be able to briefly make out whether it is a simple enlargement of the prostate or it is something cancerous. And the prostate usually starts enlarging from 20 to 30 years of age, but it usually starts causing problems only when you pass beyond 45 to 50 years of age. When the patients come to us, we do simple urine blood test. Urine test is basically to see if there's any infection, blood test to see the kidney function. And we do the ultrasound scanning mainly to see what is the size of the prostate. And post-void residual volume is basically after a patient passes urine, how much urine is left inside the bladder. So these few information we get from the ultrasound, and to see what is the person may tell that the urine speed is less, but we need to have some objective assessment to believe that the patient actually has a poor flow. So in that case, we do a uroflowmetry test when we tell the person to pass urine in one of these uroflowmetry machines, where we get to know what is the speed of the urine. And in some cases, we do the urodynamic study. Not every patient with prostate we do this. Only in some cases whom we are planning for surgery, only then we do this urodynamic study. It is basically a computerized study which will take around 45 minutes to 60 minutes, basically approximately 1 hour. Why we shouldn't neglect prostate is because it can cause damage to the bladder or the kidneys, or it can cause repeated infections. And because urine is not properly going out of the body, it can form stones in the bladder. Okay, so when we diagnose there is a prostate issue, initially these are all the options that we have. We have tablets and there are surgery options. Lifestyle changes is basically if a person is drinking lot of water, like usually you see in the media that most of the newspapers and even in the media channels, they say drink water, drink lots of water. But if somebody is having a urinary issue, one shouldn't drink too much of water. So what is too much or what is normal? Approximately around, if you take somebody who's having a prostate issues, so for him around 2 liters of water should be enough. If he keeps drinking too much of water, so you assume he's drinking 3-4 liters of water, obviously whatever the water goes inside his body, that has to come out. So he keeps going to the restroom or the bathroom repeatedly. So that will be an issue. So we usually advise them to restrict water intake to around 2 liters per day. And we tell them what is called as time dividing. That means we tell them to go pass urine once in 4 hours or 5 hours, even if you don't get any urgency to pass. Just go and empty your urine. So this is called as a time dividing. And before going to sleep, just empty your bladder. That's go pass urine before going to sleep. So these are the few things that we tell them. And also we tell them not to take too much of fluids after 6 to 7 p.m. Basically not to take much water after 7 p.m. So these are the few lifestyle changes that we advise. And if the person is not able to have any improvement with these few lifestyle changes, then we start with medications. And even if medications are not working, then we advise surgery. Okay, surgery usually it's called as a TURP, wherein we put an endoscope and see, this is the prostate gland. So this is this is the prostate tissue still present. Here we are taking the prostate tissue out. So in that way, we core out this entire prostate here, and so that the space will be open, so that the urine can easily freely come out. Again, we also use lasers also to remove the prostatic tissue. Okay, so this is briefly about the prostate. See, most of them we see, especially anybody going, they mostly get this routine health checkups done, executive health checkups done, and they come to us saying that during the executive checkup, my ultrasound report showed the final report showed prostatomegaly. So this is basically on the ultrasound. If the radiologist sees a prostate size of more than 20 grams, automatically the report will be written as prostatomegaly. So it doesn't mean that every person who has a prostatomegaly diagnosis in the ultrasound reports needs intervention. We ask the patients about the symptoms. If he has any urinary issues, only then we investigate further and start them on medications. Otherwise, just seeing a report, ultrasound report showing prostate enlargement, but a person may not be having any symptoms, then we usually don't start them on any treatment, because prostate size is not the only criteria for us to start treatment. There are so many other issues. We need to see the flow of the urine and what is his kidney function status, and after passing urine, how much urine is left inside. So we see a lot of these things. Only then we start a person on medications for prostate enlargement, and not just by seeing the prostate enlargement ultrasound report. Okay, so let me move on to the urinary tract infections now. Fine. So let me move on to the next topic, that is the urinary tract infections. So urinary tract infections, as you all know, can happen both in males and females, but prostate issues can happen only in males. Yeah, so like I showed this picture before, so infection, urinary infection can happen anywhere, starting from kidney, in the ureter, or in the bladder, or in this passage where the urine comes out. So any problem in the passage of this urine at all these places can cause urinary infection. So in males, normally no man should get a urinary tract infection in his lifetime. Suppose there is a urinary tract infection, that means he needs a full evaluation. But in females, that is not the case. 1 or 2 infections in their lifetime in females is normal. I will tell you the reason next. Just coming to the males. So every male with an UTI will require an evaluation. And most commonly in males, it is mainly due to uncontrolled diabetes. They will be having sugars of more than 300, 350, 400. Or a person may have a large prostate, because of which there is blockage of the urine, and the urine is getting stagnated in the bladder, and a person may get infection. Or there are some conditions where the bladder is unable to put the urine outside of the body, because the bladder has become so weak that it doesn't have any pumping action to put the urine out. So we call it as a neurogenic bladder. So these are the common reasons what we find in males who have a urinary tract infection. And we also see especially in uncontrolled diabetes, none of us should neglect diabetes, because it can affect from head to toe. It can be a very mild presentation, or it can cause very severe presentation. So diabetes should not be neglected. So there are, we see many patients who come to us with uncontrolled diabetes, and they come with recurrent urinary tract infections. And most of these patients, we see this is the status of their kidneys. So basically, a lot of bleeding happens in the kidney, and a lot of these tissues get necrotic. That is ಕೊಳ್ತೋಗೋದು ಅಂತ ಹೇಳ್ತೀವಲ್ಲ. So ಆ ತರ ಎಲ್ಲ ಆಗ್ಬೋದು kidney ಒಳಗಡೆ. All these things can happen. And when we put our endoscope inside the kidney and see, many a times we see this dead tissues. We call it as necrotic, papillary necrotic tissues, and we will have to remove this. Because if we don't remove these things from the kidney in a person who is having recurrent, repeated infections, whatever antibiotics we give, those antibiotics will not penetrate these dead tissues. Okay, so these are the things we usually evaluate when a person comes to us with repeated urinary infections. In females, like I said, 1 to 2, afebrile means with no fever. Urinary infections without fever in a female can happen 1 to 2 times in the lifetime, which is normal, because as you see in the picture, the urinary passage and the vagina are very close to each other, because the females have 3 outlets, whereas the men have only 2. Since the vagina and urinary passage orifice is very close to each other, so infection bacteria from this part can go to here, or from here can go to here. So because these two are very close to each other, so infections in females are common. And the other reason why urinary infections are common in females is that men have the advantage, very sadly, that they are able to pass urine wherever they want. They can just unzip and just pass urine wherever they want. The females are unfortunate, and they are known to hold urine for very long time. They hold urine for very long time. In fact, unless they find a toilet, they don't pass urine, which is normal, which we can understand. So some of them, they hold urine for 6 hours, 8 hours. So which is not to be done. So that is the reason why, that is one of the reasons why also females are prone to more urinary tract infections, because they hold urine for a very long time. And again, like I said, any blockage in the urine also can lead to infections in females. Okay, and like I said, if you see, in fact, most of the some doctors also advise saying that when there is an infection, drink too much of water. So, how much water is good for the body? Like I said, 1.5 to 2 liters should be enough. It doesn't mean that you start drinking liters of water so that the bacteria will go out of the body. That will not happen. That is just a myth. It is not a fact. See, somebody might in this group might tell me that I drink 5 liters of water, nothing happens to me. I am perfectly fit. If you are fit and if you're okay, if you're not having any urinary issues, you can continue doing that. But if somebody is having urinary issues, so you need to make these few changes. Okay, so why we tell not to drink too much water when there are urinary tract infections? Because there are enough studies in national and international studies saying that when a person drinks too much of water, obviously all that water gets converted to the urine, and the urinary bladder, where all the urine gets accumulated, it will get distended too much, and some small minor cracks appear in the bladder, and that can also lead to urinary tract infections. And other myth which we commonly hear is that, doctor, I used this public toilet recently and then I got urinary tract infection. Again, this is again a myth. This is not a fact. If a person using what is the public toilet, if he gets infection, imagine a small child who is just 1 year or 6 months child. We uh, diapers for them, we put pampers for them, and the child passes urine, stools all the time for at least 1 year of its life in the pampers, but the child doesn't get urinary infection. So you need to understand, if just going to a Nirmala toilet, if we get infection, so that is basically a myth. It is not a fact. I hope people understood this. And the other thing is, people neglect constipation. Constipation can become a very serious issue after 50 to 60 years of age. You must have seen Amitabh Bachchan's Piku movie. If you have not seen, maybe you can watch that. What constipation can cause, what all problems the constipation cause in a person's life. So why I'm stressing on constipation? How is this constipation and urinary? Okay, so this is, just imagine this as the urinary bladder, and this is where the urine comes out, and just behind that will be the rectum, that is for the motions to come out. When this parts, there is a motion part, when this gets filled up, so that can put pressure on this urinary passage and can cause blockage to the urinary flow, in which case a person may get urinary tract infection. So constipation should not be neglected. I hope all of us know what is constipation, basically unable to pass motions properly. And also there is bacterial translocation can happen. That means the bacteria from the intestines can transfer to the urinary tract. So constipation can cause urinary tract infections, so it should not be neglected. And again, there are, again, whatever I said, diabetes, constipation, all this, apart from all this, there is inherent immunity within all of us, which will ultimately take care, like how we see this corona infection. Some of them, they die, some of them, they're completely stable. So again, there is a lot of defense mechanisms happen in our body. And like I said, this is what we call as urotherapy, a good day-to-day things that you can, most of us, if we follow, most of us should not get urinary tract infection. This is the things which I already told you, that to drink around 2 liters per day. And if you're exercising or if you're losing a lot of water through sweat, then you can slightly increase your fluid intake. Like I said, pass urine every 4th or 5th hourly. And after 7 p.m., not to drink too much of water, because we see some of the patients drink around 1 liter of water just before going to sleep. And the whole night they keep getting up and they pass urine. And the simple solution to them, what we tell is, don't drink too much of water after 7 p.m. That will automatically correct your problem. Obviously, because whatever you put into the body, that has to come out of the body. So we need to do this few changes in our lifestyles. And also in children who pass urine in their bed at night, we also teach them about something called as the alarm therapy. And the other thing which I said is to avoid constipation. These are the good practices to avoid urinary tract infections. And again, circumcision, as you know, some of the religions, it is a ritual practice where you see Muslims, most of them, they get this circumcision done, and the Jewish population also get it done. Most of the Europeans and Americans get this circumcision surgery, because some of the time the urinary passage in men may be so narrow that they're unable to pass urine, and this narrowing at the tip of the penis can be a cause for urinary tract infection. In that case, a simple surgery like a circumcision where we remove this skin at the tip can correct the urinary tract infections. Okay, so next, coming to the kidney stones, which is the most common, two common conditions which we urologists see in our OPD is, the first is the prostate problem and the next is the kidney problem. So these are the most two commons. Okay, so the stones can form either in the kidney, or stones can form in the kidney and that may drop down into this tube called ureter, and that stone may come down into this bladder. So a small stones, small in the sense around 5 millimeters, not centimeters, millimeters, 6 millimeters, stones inside the kidney will not require any treatment. If the small stone inside the kidney, if it comes down this ureter like this in this image, person may get pain, because this is considered as a pipeline where the water comes. So when you put a blockage in the pipeline, obviously back pressure here develops and a person may get pain. So many of them, they come to us saying, I have 3 millimeter stone, 4 millimeter stone in the kidney, but I don't have any symptoms, no pain. So anything should be done. Our answer is, we just do the blood test to see the kidney function. If kidney function, we usually estimate by a blood test serum creatinine. If that is normal, we don't do any surgery for kidney stones of 3 to 4 millimeter size. Okay, and the next question which everybody asks is whether are there any tablets to melt these stones. There are different types of stones, calcium stones, magnesium stones, uric acid, there are so many other rare varieties of stones. Only if we get to know that the kidney stone is of uric acid, only then there are medications. No other types of stones. If you see, the most common stone is the calcium oxalate stones, for which there is no medical therapy. Okay, so how do we get to know what type of stone it is? Only when we do a surgery and when we send that stone after we do the surgery, when we send that stone for analysis, only then we get to know what is the composition of the stone. So that when the patient forms a stone second time later, maybe after 2-3 years, if we get a diagnosis of uric acid in the stone analysis report, only then we will be able to start medications for these stones. Otherwise, routinely starting medications for stones, for all stones, is not accepted. And we also have diet advice for the stone formers. See, to be frank, I do not stress too much about the diet advice. See, because many of them are diabetics, many of them have BP. and as such they will have a lot of diet restrictions. And if we again give our big list of diet restrictions, there is hardly any food left to eat. So I do not strictly insist on dietary restrictions, especially somebody is eating lot of non-veg, then I tell them to slightly restrict your high protein intake. And most importantly, in the diet advice for stones, we'll tell them to drink around 2 to 2.5 liters of water. Now you must be thinking that this doctor told me to drink 1.5 to 2 liters before, and now he's telling me to drink 2 to 2.5 liters. Why I'm saying is, somebody who has a repeated urinary infections due to prostate or because of distending his bladder too much repeatedly, in them we advise to restrict the water intake to 1.5 to 2 liters. But a simple case of kidney stones, we tell them to drink around 2 to 2.5 liters of water. So this decision we take after they consult us. Okay, and in the diet, the most controversial aspect is regarding eating tomatoes. If you say our hospital, all our urologists, we don't restrict patients eating tomatoes. But if you see some of the doctors, you must have given them given you a printed sheet saying that you should not eat tomatoes if you are having kidney stones. Again, the literature, the data on this is very poor. Just to give you an example, I was in Spain for almost 4 months during my fellowship, and if you see the amount of tomatoes the Spanish people eat, you will be shocked. And the size of tomatoes you see, it will be almost like something like a big Mosambi or a big orange. That will be the size of tomatoes in Spain. And Spanish people, they have the least kidney stones. So it doesn't mean that, so if tomatoes are causing the kidney stones, then all Spanish people or people from Netherlands and Mexico should be having a lot of kidney stones. So which is not true. Kidney stones, most of it is genetically related and sometimes depends on over a period of time, they may have some changes in the kidney because of which stones can form. And stones are for life. That means if a person gets a diabetes, just like how it is for life, there is no cure for diabetes. Similarly, for the stones also, there is no cure. What we do is, when there is a stone, we remove the stone and do some counseling, but again, the stone formation may happen. So 50% of them, they will have a stone in the next 10 years. So regarding tomatoes, there is no definitive guidelines. So you need not stop eating tomatoes just because you have a stone. Take it in moderate quantities. That should not cause any problems. And the other question they ask is, I am taking calcium tablets. Can I continue taking calcium tablets if I have kidney stones? Yes, you can continue taking calcium tablets, but take it when you are having meals, not to take in empty stomach. And the other thing which we see is flush therapy. That is, previously, maybe 10 to 20 years, this was the very common treatment for the kidney stones. Basically, when a stone is stuck here in this ureter, in the tube, then people used to give lot of IV fluids, glucose, and to drink lots of water so that the stone can pass out spontaneously. And recently, all the urological guidelines say not to do this, because if it is a small stone, it may come out. But if it is a large stone, you're putting a lot of water into the kidney, and the kidney is trying to put out that stone out. But because the stone size is very big, the urine is unable to pass through that stone. So what happens is, they may develop some cracks inside the kidney, and the urine from this can go out of the kidney in a wrong plane, which we also notice in some of the CT scans here. So just giving lots of glucose, IV glucose, or giving saline infusions are not recommended these days. But I also know that some of the doctors still do it. But this is what the latest guidelines say, not to do this flush therapy. Sometimes we put a ureteric stent, just see how most of you have heard of the stents being put in the heart. Similarly, stents are also put in the kidney also. but all these stents have to be removed after a period of uh, 4 to 6 weeks. So when we see a stone that is stuck in this ureter, when it is not coming out even after 1 month of medications, then there are different surgical options where we use something called as a ureteroscope. We put these ureteroscopes to the normal urinary passage and we blast the stone. Again, there are different procedures for the stone. In fact, this is Krishnappa, please myself, Krishnappa Pramod. So this was one of the case which we reported in a 3-year-old child. That basically a 3-year-old child had a kidney stones and we did the surgery. And when we sent that stone for analysis, we found a very rare variety of the stones, that is PHA stone. And we had to send the blood sample of the child to Iceland because they were doing this study. Iceland. So, and on the genetic analysis, this APRT gene mutation was noted in a 3-year-old child. So not all patients who have kidney stones, we do all this extensive genetic evaluation. We do this extensive genetic evaluation only when a very young child presents to us with kidney stones. In fact, this was the first case which we reported in India. And like I said, we had sent a report to Iceland and we got the confirmation done. Okay, so next, moving on to the kidney transplant. What all of us should know is that some of you must have got messages on WhatsApp saying that so and so person has met with an accident, 2 kidneys are available, please contact to this number. All these messages are fake. Please do not believe in them. No person can randomly donate his kidneys. Those laws have been removed and the rules are very strict. So just to give you an example, suppose a patient dies in a hospital or meets a road traffic accident, dies on the road. This person or his relatives cannot individually approach any other patients. They have to inform any nearby hospital. Basically, he will be taken to a hospital. The hospital authorities have to inform ZCCK, that is Zonal Coordination Committee of Karnataka, which handles all the transplants in Karnataka. And the ZCCK committee will allot the organs. And a patient or his attenders cannot say that, no, you give the kidney to this person. So I request all of you not to believe in these random messages which you get on the WhatsApp, and please not to forward also these messages, because it is not simple to randomly allocate kidneys. It has to be done through appropriate agency like ZCCK, that is Zonal Coordination Committee of Karnataka. And 2 types of kidney transplant. One is deceased donor. That means, like I said, somebody who is dead and his kidneys can be donated. And the other person is live related. Live related means either your father, mother, sister, brother, wife, or your children can donate a kidney. Your friend cannot donate a kidney. And every approval, the patient, we send the documents to Vidhan Saudha. There is a committee there, also to the health secretary. Only when we get the approval, we further proceed with the kidney transplant surgery. So all these, there are definitive guidelines and none of us can break any of these guidelines. And some of them, they tell that we also see some of them normal people coming to us saying that, doctor, please take this kidney and please donate. I want to donate this kidney to somebody else because I want some money. So we never encourage any of these things, and it is all illegal. The patient will not go to the jail, but the doctor will go to the jail for doing all these things. Okay, why not? Other question they ask is, why should I undergo a kidney transplant? I am ready to undergo dialysis twice in a week. So why should I undergo a kidney transplant? Because there is a better quality of life. So that once a kidney transplant, if everything goes fine, a kidney may be normal for the next 10 to 15 years. And there are less dietary restrictions that you need to follow if there is a successful kidney transplant. And even if you actually take a course of dialysis, getting a dialysis every 2 or 3 times in a week for all your life versus getting a kidney transplant done, in fact, getting a dialysis on a regular basis becomes very costly than getting a kidney transplant surgery. This is the briefly I told you about the kidney transplant. And next, speaking about the andrology. So andrology is one of the upcoming subspecialties in urology. It mainly deals with surgical aspects of sexual dysfunctions and also related to male infertility. Okay, see, when a couple are unable to have a children, it's very commonly in the family, the female is always blamed. Just to let everybody know here that 40% of the problems in a couple who are having problems in having a child will be 40% problems will be in the male, and the 60% problems can be in the female. So we see many couples, female has undergone all the tests, but the male doesn't come forward to get any test done because he feel my wife only has all the problems, but not me, which is not true. And what is the difference between a sexologist or an andrologist? Andrologist mainly involves mostly with the surgical aspects, and a sexologist mainly does the counseling aspects, and no surgery is done by a sexologist. Okay, and see we also see a couple are married, but they're unable to have children because I don't know if there are children watching this seminar, so I will not go into details of this. So there are surgical options which we can do, and these are not something new. These are there since almost 1970s, where a person can lead a normal life undergoing some simple surgeries. Okay, and the other thing which most of you should know, especially who are above 50 years of age, is there is something called as a testosterone hormone. That is a male hormone which is responsible for many of the aspects in the body. If you see here, a person having a normal testosterone, that testosterone basically takes care of your heart, and it is also needed for the strong bones, and also to have a plenty of energy. And a person who has a low testosterone, how do we know a person has a low or a normal testosterone? Is basically doing a blood test. In the blood test, depending on the values, we will get to know the value. And somebody who is having a low testosterone, he may require a testosterone replacement therapy. That is basically, there are gels available which a person can just apply, like how you apply cold cream. Similarly, you can just apply the gel over your shoulders, or there are injections which you can take once in 3 months, or there are even again pellet insertion surgery where you can get it done, and when you need this only once in 6 months. So testosterone again is an important hormone needed, and as the person ages, the testosterone hormone level is known to reduce. And we also see that testosterone is also abused by many gym instructors, especially who have not completed family. That means a couple are married, but they still don't have a child because they have not planned for it. For them, they are not supposed to take these direct testosterone supplements because otherwise they will have difficulty conceiving. So last topic is regarding the male fertility. Just to let you know that a man can produce sperms all his life. That means he can father all his life. But when it comes to a female cannot the female is fertile only when she is around 20 to 30 years of age. So if you just read these 2 lines, compared to a woman aged 25 years, the fertility potential of a woman aged 35 years is reduced to 50%, and it is reduced to 25% at 38 years, and it is reduced to just 5% at 40 years of age. This just means that the fertility potential of the female at 40 years is just 5%. So why I'm stressing on this is somebody who, because it is very known that the couple, these days tend to postpone having a child. So that is the reason why we see a lot of infertility cases now, lot of them undergoing IVFs, because they have not thought about this when they were young. So especially when somebody is more than 35 years, the fertility potential is very less. So most of them, they will have to undergo IVF procedures. And sometimes when there are sperms in the body, but the sperms are unable to come out of the body, in that case, we do a lot of microsurgeries in wherein we take out these sperms out of the testis, and these are used for IVF. IVF, I think most of you know it. This is basically, in simple terms, it is called as a test tube baby, where eggs are taken from the female and sperms are taken from the male, and these are fused in the laboratory, and then once it grows to 5 days, then it is transferred to the female, and the pregnancy check is done after 14 days of transfer. Okay, and in any problem, a female can go to a gynecologist, but who does a male can go to? The answer is basically an andrologist. So we also have a specialized men's health clinic at any hospitals where we take care of male reproductive organs. So it is one of its kind in South India. So this is all I have to talk regarding the urology. So I think I end my talk with this. If any questions, I will be very happy to take them.
Doctor, we have some questions from chat box, so we can take the chat box questions. So I'll just read out the first question. In case of male, will there be some sort of pain in the testicles if the patient has a prostate enlargement? Is a question.
Yeah. Okay. Pain in the testis can happen if there is because I had showed you in one of the images also, because there is a tube connecting the testis and the urinary tract, which is called as the epididymis. So problems in the urinary tract, that is prostate is a part of the urinary tract. If there is a blockage in the urinary tract due to prostate, so that infection can spread to the testis also through the tube which I told you. So there can be, I'm not saying that it is 100% seen in testis pain is 100% seen in all prostate patients, but yes, there it can happen, yes. So that means you need to get evaluated for urinary tract infection.
Yeah, the second question is, sometime when not feeling sleep, but you are lying on bed to get sleep, then many times you may feel urine, but very less amount comes out.
Yeah, so this we commonly see in females, especially the housewives who are at home, the homemakers who are at home. Once they finish the work, they sit on the sofa, and the bathroom is just lying. They're able to see the bathroom, and since they are free from work, they have the tendency that they want to go and pass urine. So especially we also see this, especially who are awake at night, and especially who are over conscious, then they may sometimes go and repeatedly keep passing urine, although only little urine comes out because there is hardly any urine inside. If this is repeatedly happening in the daytime, we call it as a overactive bladder, where the bladder randomly contracts, which is overactive, and a person may feel like repeatedly going to pass urine, in which case we will have to treat them with medication. But this happens only in the night, especially if they are awake for a short time, then a person need not worry. Try and see if you can postpone unnecessarily getting up and going out to pass urine. But if it is really very bothersome, then we may have to start medications to relax your bladder.
Yeah, the next question is, what frequency of urine passing is considered normal and not so normal?
Yeah, okay. So this I feel is a very good question, because like I repeatedly have been stressing around. So if you drink around it again depends on how much you drink and how much is coming out. Normally, if somebody is having urinary issues, we drink around 1.5 to 2 liters per day. That is good enough. If somebody drinks 2 liters of water, then he can go and empty bladder once in 5 hours. and each time there may be amount 300 to 400 ml. So that is normal. And if you see, if you ask for an exact number, there is no number anywhere in the textbook nor in any of the guidelines. So if you drink 2 liters and if you go and empty your urine once in 4 or 5 hours, that is normal.
Does tomato seeds cause kidney stone?
Yeah, I think I explained that is the reason why I specifically put that slide. So if tomato seeds would cause stones, then all the Spanish people should have had stones, because most of the Spanish people will eat at least half a kg of tomatoes every day. So like I said, it is very controversial, but we in our hospital, in all our branches, we never restrict them. We always allow you can eat it in moderate quantities. It will not, that is not the only cause for kidney stones.
What is the precaution to do for the kidney stones?
Yeah, precautions, like I said, there are a lot of dietary restrictions. Mainly if you're eating a lot of non-veg, then you will have to slightly cut down. Lot of non-veg, maybe if you're eating every alternate days, you may have to cut it down to half. And most importantly is hydration. See, if somebody is having urinary infections, then you are not supposed to drink more water. But if you don't have any urinary infections, then you will have to drink around 2 to 2.5 liters of water to prevent the stone formation. That is the most important, hydrating your kidneys by drinking water.
Is the prostate related problems are curable, or what stage it will cause a cancer or become incurable?
So I had told this. So initially, when you consult a doctor, we do a rectal examination. That is, we put a finger inside your urinary, inside the rectum, and we try to feel how hard the prostate is. If it is hard like a stone, that means it is a cancer. Then obviously the investigations will change. If it is not hard, then we assume it is a simple enlargement of the prostate. And initially, we also, like I said, I also mentioned that we also get a uroflowmetry done to see what is the urine speed. If your urine speed is normal, then we don't put you on any medication. I'm repeatedly saying, just by seeing a prostate enlargement report on ultrasound is not an indication for any treatment for prostate. If the urine speed is less, or if your kidney function is getting compromised on the blood serum creatinine test, only then we start treatment for prostate. Otherwise, we don't start. Basically, we want to see your urine flow on a uroflowmetry test.
So the next question is, I'm having a kidney stone for 6 years now, 2 times stent blast after the normal, now 4 years. I don't have pain, but it is required to visit 6 months. One time, 6 months once, but I did not check. I will do after a lockdown. Will it be okay? Any updates?
Yeah. See, like I said, the general statistics what we have is a person with kidney stones, 50% of them will have a recurrence in the next 10 years. And like I said, it is not curable anywhere in the world, kidney stones. It may recur. Some of them we have seen patients coming back immediately after 6 months, one more stone has formed. Some of them 10 years, 20 years, no stone has formed. So what we advise is once a year, get an ultrasound done and follow up the stones. If the stones are of same size, or if there is a mild improvement like 1 or 2 millimeters increase in the size of the stone, again, we don't do anything. Only when if it suddenly becomes double the size, then you may require a surgery to remove that stone. Otherwise, if you have no problem, no symptoms, no pain, then once a year ultrasound follow-up is also fine. Some doctors may say 6 months, but all our patients, we say once a year follow-up should be fine, as long as you don't get any problem.
The next question is prostate can turn to cancer?
Yes, prostate can turn to cancer. That's why we do a serum PSA test, that is a blood test. Depending on the value, anything more than 4, we sometimes consider doing a biopsy, prostate biopsy. That is, we take a part of the prostate tissue and we send it for the biopsy in the lab. They will see whether it is a normal prostate or a cancer prostate. So it can turn, but yes, we do a rectal examination in the finger also. Like I said, if it is hard like a stone, then it means it could be cancer. So that's why all prostate patients also, we tell them to follow up with us once a year.
So the next question is, in case of prostate having bacterial infection, will the patient develop a fever or headache? Is there any other health hazards?
Yeah, see, it can be, there are two types. Any urinary infection, it can be asymptomatic or symptomatic. Asymptomatic is only the urine report or the urine culture will be showing positive. It means showing bacteria or lot of pus cells, but the patient may not have any symptoms. During some routine checkup, all this or a health checkup or while joining some new company, all these tests were done, and only it is there in the urine reports, but the patient doesn't have any symptoms. Then sometimes we do not, depending on the age, we do not treat these things. And other extreme is symptomatic UTI, where the person may get burning while passing urine, which we call burning micturition, or the patient may even have urgency, that is every half an hour he feel like going to bathroom, or the patient may develop fever. Just because there is urine infection on the urine report, it doesn't mean that every person should have a fever. Asymptomatic is also there, symptomatic is also there. But if it is symptomatic, that is if there is a fever, it means it is of slightly higher degree. So definitely that requires a detailed evaluation. And of which uncontrolled diabetes is the most common cause we see in most of our patients.
So the next question is, what is the success rate of IVF if the couple are 42 years of age?
Yeah. Okay, I didn't want to go into too much of the andrology aspect, male infertility, because I didn't know what will be the crowd here. Yeah, see the success rates. I was in Chicago for the male infertility training. That I worked in the University of Illinois and also the fertility centers of Illinois, both in the university level and also at the private level. Why I'm saying is this, because even in US also, the success rates of IVF is around 55 to 60%. It is not 80%, it is not 90%. If some doctor is saying you that I give you 80-90% assurance with the IVF, then it is not true. Because if 100 people undergo IVF, only 60 of them will get pregnant in the first IVF cycle. If that fails, they may have to go for the second cycle. I understand there are significant costs involved in the IVF, but again, hospital also has to invest lot of equipments to take care of the IVF lab. In success rates, to answer is around 55 to 60% all over the world.
So the next question is regarding prostate enlargement. I'm on medication for past 5 years. Its name is, I think, Sildenafil D8. If there are no changes, how long is it recommended to continue medicine, or is it better to go on for the surgery? Current the size is 1.8 psi.
Yeah. So it depends again. So if somebody is on a tablet, and if he's having good improvement with the tablet, then he has to take this tablet lifelong. It is like diabetes. You can't stop diabetes tablet after 1 month or 2 months. Similarly, prostate medications cannot be stopped. Some of them, after 5 years, they are still on tablet. Then they start noticing the speed of the urine is reducing, even though being on tablets. Then the surgical option they will have to undergo. If somebody who comes to us with around just 50-55 years of age, who is still young, see, we still 50-55 years for us is still young. So he has to be on tablets, maybe if he's going to survive for the next 70-80 years. So he has to be on this tablets for the next at least 20 years. For them, we advise, see if you would like to consider surgery, because you will have to otherwise you'll have to take these prostate tablets for a very long time, till next 20-25 years. So in that case, if somebody very young guy comes, we give them the option of surgery initially itself. If somebody is around 70-75 years, we tell them it's okay, maybe you can, if you're having good improvement with tablets, you can just continue taking tablets. So age, and again, if somebody is getting repeated infections, even though being on prostate tablets, then that is also an indication for early surgery.
So the next question is, what are the symptoms of UTI?
So again, like I said, UTI can happen from starting from the kidney till the end of the urinary passage. it depends on again where the infection is. If there's infection, UTI is in the kidney, then a person may get pain in the sides, in the flank, in the lateral side of the abdomen. He may get pain and fever. If the urine infection is only in the bladder, then the person may get feel like going repeatedly to the bathroom. That is, we call it as increased frequency. Every half an hour he may keep going to the bathroom, and severe burning while passing urine. So these are the common complaints which we see in UTI.
There are a few basic questions. What is the reason for dark color urine, and what is the function of kidney?
See, kidney function, basically it is most important is to take out all the metabolites, all the toxic materials from the body. That is the main function, basically. To put out all the toxic materials out of the body. That is the main function. And it is also involved in calcium metabolism of the calcium, and also vitamin D metabolism. And the urine color, we sometimes see, especially in the summer, or if you have not had drunk water for a very long hours, then the urine automatically turns slightly darker yellowish in color, which is normal. Again, you can drink maybe half a liter or 1 liter of water, and you can check again the urine color. If it is normal color after drinking water, then you don't have to worry about that.
So the next question is: do women have to undergo normal deliveries of their babies have a tendency to urinate every now and then, as it is difficult to hold even a little urine in a bladder? Is it because of the uterus press in the bladder?
Yeah, so that is not because of uterus pressing the bladder. It is, we call it as stress incontinence, which is very, very common in female. Stress incontinence is that when they cough severely, the urine leaks. And when they laugh loudly, the urine leaks. And they are not able to hold urine for a long time. So these things, we call it as stress incontinence. Very common in females, especially those who have had a normal delivery, because you can imagine when such a big head of the baby comes out of the vagina, there are so many structures also surrounding the vagina. So there are sphincters which hold the urine, sphincters. So all these may get stretched so much that they become very loose after the normal delivery. That's why if you see some of the film stars and some of these noted celebrities, they avoid going for a normal delivery, and that's the reason they get the cesarean sections done. I'm not saying everybody should get cesarean section. I'm saying these are some of the disadvantages of going to a normal delivery. And this stress incontinence, initially we try to treat them with tablets, and we tell them that's what simple things like go and empty the bladder every 4 hours. And if still they're not able to have any improvement with medications and some lifestyle changes, we advise surgeries for them. Surgeries, basically we tighten the sphincter so that they can hold urine for a longer time.
So the next question, I think already addressed. I think they're posting again to answer it. How many liters of water to drink to maintain good health, and how much at a time?
Yeah. So to tell in simple words, you can drink around 2 liters is fine. If you're going to gym, if you're exercising a lot, if you're the person who sweats a lot, because you will be losing a lot of water in the sweat. So in that case, your urine output may be slightly less. So in that case, normally 2 liters is enough. If you're sweating a lot, maybe extra, or if you're working out a lot, or if you're doing a lot of field work where you sweat a lot, in that case, extra half a liter you can drink. No need to drink 4 or 5 liters. It is not required. If you're still drinking, but if you're not having any problems, then you can continue doing that. But as a doctor, around 2 liters should be enough.
The next question is there any medication to reduce the creatinine levels?
No, see, creatinine levels, if it is high, that means that there is some blockage of urine or the kidney function has gone down. Okay, for the blockage, if there is any blockage either by stone or some cancer or some tissue which is blocking the urine, whatever that is blocking the urine, that has to be removed. If there is no blockage, that means your kidneys are weak. So in that case, you may end up in dialysis, or a kidney transplant may be required depending on how high is the creatinine level. The normal creatinine level for a man is around, again, depends on lab to lab. On an average, it is around 1.3 for a man and it is 1 for female. If it is creatinine is something very high, like 4 or 5, definitely you may require a dialysis or a kidney transplant. So there is no simple way to reduce the creatinine just by diet. There is no one.
Any particular physical activities you suggest in nephro perspective?
No, physical, for the nephro, there is nothing. But for the urology, especially when somebody is having, like I said, the stress incontinence, that is the spontaneous urinary leaks, for them, we advise something called as a Kegel's exercises. You can just write it down. You can Google and see. Kegel is Kegel. Kegel's exercises, where we tell the patients, just like, suppose if you're in a meeting somewhere, if you feel like passing urine suddenly, or if you feel like going to pass motions immediately, what do? So you try to control the sphincters. So that is what you will have to do, the Kegel's exercises, morning, afternoon and evening. Whenever, do it for at least 10 to 15 minutes. You can do it even when you're watching TV also. So you can just Google what is Kegel's exercises, you will get to know. Kegel. And if somebody is having erectile problems, having difficulty in intercourse, and for them also we advise some cardio exercises. Any cardio exercises basically improves the blood supply to the lower part of the body, in which case some of the erectile issues also can get improved. And otherwise, for the nephro specifically, there is no any exercises to suggest. See, just to again to tell you what is nephrology, what is urology. Nephrology is mainly the medical aspects, and they treat only the kidney. Urology is all the surgical aspects. All the surgeries are done by the urologist, and we just not treat only the kidney. Like I said, I had showed you the diagram: kidney, ureter, bladder, prostate, testis, penis. All this we treat. Whereas the nephrologists treat only kidneys and they don't do surgeries. Nephrologists. That is the basic difference.
The next question is, any advice on alcohol intake in perspective of this urologist?
See, alcohol intake in the urology, smoking definitely has a lot of impact in urology. It causes a lot of cancers, especially the bladder cancer and kidney cancers are caused. One of the major causes is smoking. Alcohol, there is no specific urological problem. If you're taking it in moderate amounts, it will not cause major issues, except that you may have some erectile dysfunction problems occasionally because of alcoholism. But otherwise, if you're taking alcohol in moderate quantities, then usually it has no major impact in urology. Smoking definitely has, even if in small amounts also, smoking can cause not only cancers, but also it can lead to infertility issues, because sperm motility, that is movement of the sperms in the testis, can get affected and they may have a problem in conceiving.
Thank you, sir. I think we have done with all the questions. So we supposed to complete at 11:30, but we exceeded for 8 minutes. Thank you very much. It was wonderful, and this session was very helpful to all of us. And I would request Rajesh Naik. Rajesh Naik is our president. I thank you very much for your presence, sir, actually, for clarifying many of our doubts. Thank you very much for, in fact, we are, in this community, we have a lot of sports people, runners. We also have an event called running, Pride Run. So all these people are Pride runners. So for the benefit of them, we have initiated this program along with Rotary.
My suggestion for all the runners is that not to take any testosterone by the influence of any of your friends, because we see a lot of abuse, testosterone abuse being done by especially the gym people who go for the gym or runners, and they have a lot of problems later. Okay, let's not continue. I won't continue too much. So just that was the advice from my side, not to take testosterone.
Thank you, sir.
Okay, thank you. Thanks a lot, sir. Thank you all for spending a Sunday 1 hour with me, and hope to coordinate in more further activities. I'll be very happy to.
We also want to thank Mr. Jairamaya. He's our past president, and in fact, he has taken initiative to invite you for this activity. Thank you very much, sir. I think Rajesh has come.
I was there throughout the session. Excellent session. Thank you, sir, for giving us this, what you say, gyan, and then guiding us insight into our testosterone and stuff like that. It was a recollection for me. Thank you very much. you, Ramesh, for having this particular event. Thank you.
Thanks.
Please
For the
continue.
opportunity, sir.
Thank you very much. Thank you, everybody.
Thank you. Bye-bye.
Bye.